Seniors, beware. 9. Popular medications that can trigger rapid dementia. It is a sobering and deeply concerning reality that unfolds every minute of every day. By the time one finishes engaging with this vital information, approximately 20 seniors across the nation will have been delivered the devastating news of a new dementia diagnosis. This isn't just a fleeting statistic, it represents a profound personal tragedy occurring relentlessly every 66 seconds, impacting countless families and irrevocably altering countless futures. Yet, what should truly evoke a heightened sense of alarm and compel immediate introspection is the disturbing possibility that the very genesis of this cognitive decline might not be the inevitable march of time or the natural process of aging, but rather something far more insidious, something perhaps innocuously residing within one's own medicine cabinet. For years, countless individuals have been consistently reassured that the pills they dutifully take are not only safe and routine, but are, in fact, absolutely necessary pillars supporting their continued health and well-being. However, a deluge of groundbreaking new research, meticulously conducted and rigorously peer-reviewed, is now unequivocally raising a chorus of serious red flags, challenging these long-held assumptions with stark and alarming evidence. Astonishingly, a staggering 99% of seniors remain utterly unaware that at least one, and often more, of the medications they are consuming daily could be actively contributing to the physical shrinking of critical memory centers within their brain, a reduction that can exceed 28% in less than 12 short months. This profound anatomical alteration has direct and dire consequences for cognitive function and overall mental acuity. Dr. Michael Kent, a physician who has witnessed this heartbreaking pattern far too frequently in his professional practice, understands the immense gravity of this information. He observes how deeply people trust their prescribed medications, operating under the deeply ingrained yet dangerously flawed assumption that if a doctor has recommended it, it must inherently be harmless. Concurrently, a troubling narrative emerges from the pharmaceutical industry, which, despite having been acutely aware of these devastating neurological effects for many decades, has continued to reap billions of dollars in profits from the relentless marketing and sale of these very same drugs, medications that are now strongly implicated in accelerating cognitive decline among millions of seniors throughout the country. A compelling 2023 study, meticulously documented and subsequently published in the esteemed journal Neurology and Aging Research, made a startling discovery. A specific class of medications was found to dramatically increase the risk of dementia by a staggering 49% in seniors who use them regularly for just 2 years. This is not merely a minor or marginal increase. It represents nearly half again the normal risk, a proportion that demands urgent attention and decisive action. This comprehensive discussion will meticulously unveil the 9 most dangerous medications, meticulously ranked from those commonly overlooked to those that are truly and unequivocally mind-destroying, all of which are implicated in triggering rapid memory loss and precipitating dementia. Among these, the third medication on our critical list is one that is routinely prescribed to millions of seniors for conditions that appear entirely innocuous and benign. Yet, unbeknownst to many, it possesses the alarming capacity to shrink vital memory centers in the brain, often without the individual ever realizing the silent damage occurring within them. Before embarking on this deep exploration of crucial information, it is imperative to foster an open dialogue. We earnestly invite you to share your experiences in the comment section below. Which medications are you currently taking on a daily basis? Have you ever noticed any sudden onset of bewildering brain fog, an unsettling increase in unexplained forgetfulness, or any other inexplicable cognitive shifts after commencing a new prescription? We are committed to meticulously reviewing every single comment, providing thoughtful and personalized insights tailored to your specific situation. Your voice is invaluable. Do not remain silent about this profoundly important issue, as speaking up about your concerns and observations could quite literally be the pivotal action that safeguards your own mental acuity and cognitive future. Without any further delay, we begin our crucial countdown at number 9, a medication whose seemingly benign nature should not lull anyone into a false sense of security regarding its position on this list, as it might be currently scrambling the delicate neural pathways of your brain even before you perceive the first overt symptom. This medication, diphenhydramine, widely recognized and sold under the ubiquitous brand name Benadryl, is present in almost every senior's medicine cabinet at this very moment. Diphenhydramine is that familiar little pink pill, a staple that millions of individuals confidently trust to alleviate seasonal allergies, mitigate bothersome cold symptoms, or, most commonly, to assist in inducing sleep. Its widespread appeal is amplified by its affordability, ready availability over the counter at virtually any drugstore, making it highly probable that a bottle of it currently resides in your nightstand or bathroom cabinet, while you may sincerely believe you are merely consuming it for a better night's rest or relief from annoying allergy symptoms. Within the intricate landscape of your brain, Benadryl is actively and systematically disrupting your hippocampus. This specific region is a cornerstone of memory, playing an indispensable role in the formation and storage of new memories, a process vital for daily function and learning. Benadryl belongs to a broad and concerning family of drugs known as anticholinergics, which exert their effects by blocking acetylcholine, a crucial neurotransmitter. Acetylcholine acts as a pivotal chemical messenger, facilitating robust communication between neurons, aiding in the creation of new memories, and maintaining an optimal state of alertness throughout the day. As the human brain naturally ages, its production of acetylcholine diminishes, rendering it increasingly dependent on every remaining molecule it can produce. Consequently, when medications like Benadryl interfere with this incredibly delicate and vital process, the ensuing results can be absolutely devastating for cognitive function. A sobering 2023 study published in the authoritative Journal of Geriatric Cognitive Health revealed that seniors who regularly used anticholinergic drugs experienced a 54% higher risk of developing dementia compared to those who meticulously avoided these medications entirely. This staggering figure translates to more than half again the normal risk, originating from a substance most people unthinkingly regard as a harmless sleep aid. To safeguard your invaluable memory, the primary and most crucial step is to meticulously avoid anything containing diphenhydramine, especially if the product label specifies PM, nighttime, or allergy relief, as these products are frequently just Benadryl cunningly masked under different names. If you are currently reliant on diphenhydramine for allergy relief, rest assured that much newer non-sedating options exist, such as loratadine, commonly marketed as Claritin. These newer generation antihistamines are engineered not to cross the blood-brain barrier as readily, rendering them dramatically safer for sustained, long-term use in seniors and significantly reducing the risk of cognitive impairment. It is paramount to reiterate the importance of never abruptly discontinuing any medication without explicit medical guidance, but simultaneously never fall into the perilous trap of assuming that over-the-counter automatically equates to safe for your brain. Moving to number 8, we examine a medication often touted as harmless and gentle on the digestive system, yet it systematically interferes with the very nutrients your brain desperately needs to maintain its sharpness, vitality, and overall health. This class of drugs comprises proton pump inhibitors, specifically those widely known as Prilosec and Nexium. These medications, colloquially known as PPIs, are specifically formulated to aggressively reduce the production of stomach acid and are frequently prescribed for common ailments such as heartburn, GERD, gastroesophageal reflux disease, and other acid reflux problems. Many seniors find themselves tethered to these medications for extended periods, sometimes spanning years or even decades, primarily because they're uncomfortable and disruptive. Symptoms swiftly return as soon as they attempt to discontinue their use. However, what is rarely, if ever, adequately discussed with patients is the insidious manner in which PPIs systematically impede the absorption of essential nutrients, most critically vitamin B12. Vitamin B12 is an absolutely crucial nutrient, playing an indispensable role in protecting delicate brain tissue, supporting robust memory function, enhancing mental focus, and maintaining stable mood regulation. In a groundbreaking 2016 study, meticulously published in JAMA Neurology, researchers undertook an exhaustive examination of over 73,000 individuals aged 75 and older. Their findings were unequivocally alarming. Regular PPI users exhibited a 44% increased risk of developing dementia compared to individuals who did not utilize these medications. By suppressing stomach acid far too aggressively, PPIs profoundly interfere with your body's natural and critical ability to absorb not only vitamin B12, but also other essential minerals like magnesium and calcium, both of which are fundamental for efficient neural transmission and proper brain cell signaling. Without adequate levels of these vital nutrients, your neurons struggle immensely to fire efficiently, leading to frustrating misfirings, episodes of confusion, and distressing memory lapses that frequently mirror the exact early warning signs of Alzheimer's disease, tragically leading to misdiagnosis. Yet, the problem extends even deeper than mere nutrient depletion. PPIs have also been scientifically demonstrated to elevate levels of amyloid beta plaques in the brain. These insidious proteins are notorious for actively disrupting normal brain function and are widely considered one of the core drivers of Alzheimer's disease progression, accelerating the pathology of the illness. The excellent news amidst this concern is that safer and often equally effective alternatives are readily available. If you are currently using a PPI every single day, it is imperative to initiate a candid conversation with your doctor about the possibility of slowly and safely tapering off the medication, potentially with the transitional assistance of H2 blockers such as famotidine, sold under the familiar brand name Pepcid. While H2 blockers are not entirely without their own considerations, they are significantly less likely to interfere with cognitive function. Furthermore, a natural compound known as deglycyrrhezonated licorice, DGL, which gently coats and soothes the stomach lining, can offer substantial symptom relief without any of the cognitive harm associated with PPIs. Our seventh entry brings into focus a medication frequently prescribed for bladder control issues, yet it harbors the potential to wreak absolute havoc on both your short-term memory and your delicate emotional balance. We are referring to bladder control medications, specifically oxybutynin, which is commonly sold under the brand name Ditropan. Oxybutynin is routinely prescribed to seniors grappling with the challenging and often embarrassing issues of urinary incontinence or overactive bladder problems. On the surface, it presents itself as a practical and highly helpful solution, as no one desires to contend with the inconvenience or social discomfort of frequent and urgent bathroom trips throughout the day. However, the insidious mechanism by which this medication operates is by blocking acetylcholine, precisely the same critical brain chemical that is detrimentally disrupted by medications like Benadryl. Crucially, unlike some milder anticholinergic medications, oxybutynin possesses the problematic characteristic of crossing the blood-brain barrier with remarkable ease, thereby directly and powerfully affecting the sensitive memory regions within your hippocampus. This particular characteristic renders it exceptionally dangerous for seniors, especially when its use is prolonged over extended periods of time. A comprehensive 2019 study meticulously published in the British Medical Journal unveiled disturbing findings. Researchers discovered that individuals over 65 years of age who regularly took strong anticholinergic medications, such as oxybutynin, for more than a single full year had a 49% higher risk of developing dementia. This staggering figure implies that nearly 1 in every 2 users is at an elevated risk. What makes this revelation even more profoundly concerning is the tragic fact that the vast majority of seniors are never adequately or properly warned about these serious cognitive side effects. They are merely informed that the medication will effectively help control their bladder, without any mention of its potential to actively accelerate mental decline with every single dose. The cognitive harm inflicted by such drugs is regrettably, often mistaken for the normal and unavoidable processes of aging. Patients frequently articulate feelings of persistent mental fogginess, describe forgetting important appointments with alarming regularity, constantly misplacing everyday items, or suddenly struggling immensely to follow and keep track of simple conversations. This decline is rarely connected back to the medication until significant and often irreversible damage has already occurred. Therefore, if you are currently taking oxybutynin and have observed any mental changes whatsoever, it is crucial to understand that these symptoms are not merely in your head, and you absolutely do not have to remain reliant on this particular drug to maintain bladder control. Fortunately, much newer and safer medications are now available, such as mirabegron, which is sold under the brand name Mirabetrix. This medication operates through a completely different physiological mechanism within your body and has consistently demonstrated significantly less impact on vital memory function. These newer pharmacological agents do not block acetylcholine at all and are generally considered substantially safer options for older adults who require effective bladder control support, offering a pathway to managing symptoms without sacrificing cognitive health. Number 6 directs our attention to statins, which are among the most widely prescribed drugs globally, particularly for individuals over 60 years old. Their primary purpose is to effectively lower cholesterol levels, thereby reducing the perilous risk of heart attacks and strokes. Specifically, simvastatin and atorvastatin, marketed under the popular brand names Zocor and Lipitor respectively, represent the two most commonly prescribed versions. However, a serious and often overlooked problem begins here. Cholesterol is not merely a cardiovascular health concern, it is an absolute necessity for optimal brain function. Your brain, remarkably, is composed of nearly 60% fat, and cholesterol plays an absolutely critical role in the creation and meticulous maintenance of the myelin sheath. This myelin sheath is a vital protective coating that enables nerve signals to travel smoothly, rapidly, and efficiently throughout your brain, facilitating robust communication between neurons. When cholesterol levels are aggressively lowered through the potent action of these medications, there is a distinct risk that you may also be inadvertently starving your brain of the precise substance it desperately needs to function properly. A concerning 2023 study, published in Frontiers in Aging Neuroscience, revealed that seniors over 70 who had been consistently taking statins for more than 3 consecutive years exhibited a 26% higher risk of developing mild cognitive impairment. Furthermore, those taking high-dose statins experienced even more pronounced and noticeable declines in their overall mental function. What is even more alarming is that some patients have reported sudden onset memory loss, describing frightening and disorienting moments where they could not recall familiar names, recent conversations they had just engaged in, or even established driving routes they had navigated for years, highlighting the profound and immediate impact these drugs can have. It is absolutely important to understand that not all statins affect the brain equally. Certain medications within this class, such as pravastatin and rosuvastatin, do not cross the blood-brain barrier as easily and are consequently considered significantly less risky in terms of inducing cognitive side effects. If you have been on a statin for several years and are starting to notice persistent mental fog, an increasing tendency towards forgetfulness, or growing confusion, it might be time to initiate a serious and frank conversation with your doctor about either a potential dose reduction or exploring an alternative cholesterol management strategy that prioritizes your cognitive health. Do not delay until the damage becomes irreversible. The earlier you take decisive and informed action, the better your chance of protecting your mind and preserving its sharpness for all the years to come. Next, at number 5, we address a class of drugs known as benzodiazepines. These widely prescribed medications, which include commonly recognized drugs such as lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are among the most frequently dispensed in America for the management of anxiety disorders and persistent sleep problems. They exert their calming effects by enhancing the activity of GABA, which is your brain's natural calming chemical. GABA acts to reduce overstimulation and subdue excessive nervous system activity, creating a sense of tranquility. Initially, these medications often appear as absolute lifesavers, offering immediate relief. They effectively quiet racing thoughts, dramatically ease the debilitating grip of panic attacks, and facilitate falling asleep at night for those plagued by insomnia. However, over time, these drugs insidiously transform into something else entirely. They become a perilous trap from which it is incredibly difficult to escape. A significant 2022 study, published in the esteemed British Medical Journal, meticulously tracked over 8,000 seniors over an extensive 6-year period. Their findings were stark. Those who had used benzodiazepines for more than 3 months had a staggering 51% increased risk of developing Alzheimer's disease. The risk escalated even higher for long-acting benzodiazepines like diazepam, which persist in your body for much longer durations and tend to accumulate in fatty tissues, including the delicate tissue of your brain, thereby prolonging their detrimental effects. What fundamentally transpires is a kind of chemical sedation that progressively yet relentlessly slows down neural activity throughout your entire brain. This means that your brain's capacity to learn new information is severely hampered. It becomes less flexible in adapting to new situations, less efficient in processing information, and increasingly prone to confusion, disconcerting memory gaps, and a profound sense of emotional numbness. Seniors who regularly take benzodiazepines frequently describe feeling as though they are perpetually moving through a constant, heavy fog, feeling profoundly disconnected from reality, or simply not feeling like themselves anymore, a tragic erosion of their identity. And the absolute worst, most agonizing part of this situation arises when they attempt to stop taking the medication. Withdrawal symptoms can be absolutely brutal, manifesting as severe anxiety, intense agitation, and debilitating insomnia, sensations that can be so overwhelming that they falsely reinforce the perception that the drug is absolutely essential, when, in fact, it has become the primary source of the very problems it was initially prescribed to alleviate. To correct this dangerous and pervasive situation, here is precisely what action is needed. If you have been consistently taking a benzodiazepine for more than a few weeks, it is absolutely critical that you do not stop suddenly under any circumstances, as abrupt cessation can be genuinely dangerous and, in extreme cases, even life-threatening. Instead, it is imperative to work closely and collaboratively with a knowledgeable doctor to very gradually taper the dose down over a period of weeks or even many months, allowing your brain and body to slowly reacclimate. Safer alternatives exist, such as buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy, CBT, specifically designed for managing insomnia and anxiety disorders. These therapeutic approaches can effectively help restore calm and peace to your life without inflicting the progressive memory loss and cognitive decline so frequently associated with benzodiazepine use. Number 4 on our critical list is amitriptyline, sold under the brand name Elavil. Amitriptyline, though an older antidepressant, is still surprisingly and commonly prescribed today for a variety of conditions, including chronic pain, stubborn insomnia, and sometimes even for the prevention of migraine headaches. At first glance, it might deceptively appear to be a versatile, multi-use miracle pill, capable of solving several challenging problems simultaneously. However, beneath this seemingly benevolent surface, it is, in reality, one of the most potent anticholinergic medications still in widespread circulation today. This means that it powerfully and aggressively blocks the action of acetylcholine, that indispensable chemical messenger that facilitates robust communication between neurons, enables the formation of new memories, and maintains mental sharpness. In fact, amitriptyline blocks acetylcholine with such formidable strength that cognitive effects are not merely potential side effects, they are essentially expected and almost inevitable consequences with sustained long-term use. In a massive 2015 study, meticulously published in JAMA Internal Medicine, researchers carefully examined over 3,400 adults aged 65 and older. Their findings were alarming. They discovered that those who took higher cumulative doses of anticholinergic medications like amitriptyline over an extensive 10-year period had a staggering 54% greater chance of developing dementia. This is not just a slight or negligible increase in risk. It represents more than half again the normal risk of dementia, a figure that demands serious reconsideration of its use. What is absolutely terrifying about this situation is the tragic fact that the vast majority of these patients were never adequately informed that this drug could actively and detrimentally harm their memory function. They were often prescribed amitriptyline for conditions such as sleep problems or persistent nerve pain, and then slowly and subtly they began to notice troubling changes, frustrating short-term memory loss, difficulties in finding the right words during conversations, word-finding difficulties, and increasingly foggy concentration that interfered with daily tasks. It is crucial to understand that it does not even require a high dose to cause serious problems. Even low-dose amitriptyline taken nightly over several years can initiate a slow, insidious, and invisible erosion of brain power that progresses completely silently. The damage often occurs without any clear warning signs at first, just a gradual and confusing decline that is tragically misattributed to normal aging, when in fact it is drug-induced cognitive impairment that could have been entirely prevented. Therefore, if you or a loved one is currently taking amitriptyline, it is imperative to speak with your physician immediately about exploring safer and equally effective alternatives. For nerve pain, options such as duloxetine or gabapentin may offer equivalent relief without carrying the same severe anticholinergic burden. For sleep problems, melatonin or very low-dose doxepin, which possesses a much milder anticholinergic profile, can be utilized instead with far less risk to cognitive function. And for mood support, there are much newer, more sophisticated antidepressants available, such as sertraline or escitalopram, that are generally considered dramatically safer for long-term brain health, offering effective treatment without compromising mental acuity. Our countdown brings us to number 3, paroxetine, widely recognized by its brand name Paxil. Paroxetine is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, used for the treatment of depression and anxiety disorders. At first glance, it appears to be a modern, sophisticated antidepressant designed to be gentler and inherently safer than the older generations of psychiatric drugs. However, here lies the critical piece of information they rarely disclose. Paroxetine is singularly unique among all SSRI medications in that it possesses significant anticholinergic properties, meaning it actively interferes with acetylcholine in your brain. This one crucial detail renders it drastically and fundamentally different from its SSRI siblings, such as sertraline or escitalopram, which do not share this problematic characteristic. A large and comprehensive 2021 review, meticulously published in Frontiers in Psychiatry, specifically examined the cognitive profiles of elderly patients taking various SSRI antidepressants. Their findings were stark and concerning. Paroxetine users exhibited measurable declines in short-term memory, a reduced ability in verbal recall, and a diminished attention span within just the first 12 months of treatment. The study further discovered that seniors taking paroxetine were 30% more likely to exhibit early warning signs of cognitive impairment compared to those taking other common antidepressants, highlighting its specific detrimental impact. The cruel irony embedded in this situation is that paroxetine is often prescribed with the explicit intention of stabilizing mood and reducing anxiety. Yet, over time, it ends up systematically undermining mental clarity and emotional regulation, ultimately defeating its own therapeutic purpose and leaving patients in a worse cognitive state. The necessary fix here is straightforward, yet absolutely essential for the long-term health of your brain. Avoid paroxetine entirely in senior populations. The American Geriatric Society has officially placed paroxetine on its Beers criteria list, which is a meticulously compiled and widely respected list of medications deemed potentially inappropriate for older adults due to legitimate safety concerns, particularly regarding cognitive function. If you are currently taking this medication, it is vital to engage your physician in a conversation about switching to much safer alternatives, such as sertraline or escitalopram, which are significantly better tolerated by older adults and do not carry the same serious cognitive risks. Additionally, supplementing your diet with essential B vitamins, especially vitamins B12 and B6, can provide natural support for mood stability and may, in some cases, reduce your overall reliance on antidepressant medications, fostering a more holistic approach to mental well-being. Our second entry on this alarming list spotlights antipsychotics. This category is especially alarming and disturbing because many seniors, and often their families, don't even realize they are taking an antipsychotic medication. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed, rigorously tested, and officially approved to treat severe and debilitating psychiatric conditions such as schizophrenia and bipolar disorder. However, today, they are frequently prescribed off-label to elderly patients for what are often considered common sleep problems, mild agitation, or difficult behavioral changes, often those associated with dementia itself. That's right, these are incredibly powerful drugs, meticulously designed for the gravest psychiatric illnesses, but they are now being routinely and controversially used in nursing homes and hospitals for seniors who are simply confused, restless, or deemed difficult to manage by staff. The consequences of this widespread and often inappropriate practice are absolutely devastating and deeply unethical. In 2022, a comprehensive study published in the prestigious Lancet Healthy Longevity meticulously followed more than 25,000 older adults and found that seniors who were prescribed antipsychotics for behavioral symptoms were a staggering 71% more likely to develop worsening cognitive decline within just 12 months, even if they had absolutely no prior history of dementia before commencing the medication. Even worse, these dangerous drugs dramatically increase the risk of serious adverse events such as stroke, sudden cardiac death, and severe sedation, which can directly lead to dangerous falls, emergency hospitalization, or even permanent institutionalization in a nursing facility, tragically diminishing quality of life. The underlying mechanism behind this damage is brutal and direct. These medications aggressively suppress dopamine, a critical chemical neurotransmitter that is not only intimately linked to mood, motivation, and pleasure, but is also absolutely indispensable for executive function and memory processing in your brain. When dopamine levels crash dramatically due to the action of these drugs, your brain becomes profoundly sluggish, slow, and unresponsive to stimulation. This is precisely why seniors taking antipsychotics often appear dull, emotionally flat, or completely zombified. Their vibrant personalities seem to fade away, leaving family members grieving for someone who is still physically present but mentally and emotionally absent, a profound loss of identity. Correcting this tragic and pervasive situation starts with asking hard, direct, and unyielding questions. If you or a loved one is currently taking one of these powerful medications, it is paramount to ask the prescribing doctor why it was prescribed in the first place and whether it is truly medically necessary or simply being used for convenience of care staff. In the vast majority of cases, behavioral symptoms can be effectively managed with non-drug interventions that prioritize the patient's well-being and dignity. These interventions include creating structured and predictable daily routines, meticulously reducing environmental noise and overstimulation, compassionately addressing underlying pain or physical discomfort, and dramatically improving lighting and sleep hygiene. When medications are absolutely and unequivocally necessary, using the lowest possible doses for the shortest possible periods can significantly mitigate harm. But more often than not, these drugs are being used out of pure convenience for staff, not genuine medical necessity for the patient, representing a profound failure of care. The real tragedy lies in the fact that many families are never even informed about what these drugs actually do to the brain. They just helplessly watch their loved one rapidly declining without ever knowing that the cause is chemical, not simply the natural process of aging perpetuating a preventable suffering. Finally, we arrive at number 1, anticholinergic polypharmacy. This represents the hidden danger that almost nobody talks about, and it is genuinely one of the biggest, yet most overlooked contributors to drug-induced dementia in the elderly population. You may have been expecting a single specific drug to top this ominous list. However, the most dangerous medication situation for triggering rapid dementia in seniors isn't one particular pill. It is the silent, insidious, and creeping cumulative effect of taking multiple medications, each possessing anticholinergic properties at the exact same time. This perilous situation is precisely what medical professionals term anticholinergic polypharmacy. To illustrate this all-too-common scenario, imagine a senior diligently taking diphenhydramine every night for sleep, oxybutynin daily for persistent bladder control issues, and amitriptyline for chronic pain management. Each of these medications, taken in isolation, might cause only mild, barely noticeable memory problems. However, when these anticholinergic drugs are taken together, their individual effects compound exponentially, and the cumulative anticholinergic burden on your brain absolutely skyrockets, overwhelming its natural defenses. This is not merely a theoretical concern or an academic worry. It is a stark clinical reality. In a compelling 2022 analysis meticulously published in Age and Aging, researchers meticulously tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a staggering 120% increased risk of developing dementia within just 10 years. That is more than double the normal risk, a figure that should send shivers down the spine of anyone relying on multiple medications. And here is the absolute worst part of this devastating situation. The vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications. Nobody had ever explained this critical concept to them. When you block acetylcholine from multiple different angles simultaneously, your brain doesn't just slow down temporarily, it begins to actively decay and deteriorate at a fundamental level. Neurons physically wither from chronic underuse and lack of stimulation. Vital synapses shrink and eventually disappear, and your brain enters a profound hypoactive state that looks nearly identical to Alzheimer's disease on standard cognitive testing, leading to tragic misdiagnoses and missed opportunities for intervention. Correcting this dangerous and prevalent situation does not require a miraculous cure or exorbitantly expensive treatment. It simply necessitates a thorough, comprehensive, and attentive medication review. It is paramount to ask your doctor or pharmacist to carefully evaluate your complete list of prescription medications, over-the-counter drugs, and even dietary supplements for their cumulative anticholinergic load. There are sophisticated online tools and professional software programs readily available that can calculate your cumulative anticholinergic burden score, providing a clear picture of the risk. Once the problematic medications are identified, you can then work systematically and collaboratively with your healthcare team to deprescribe, which means slowly and safely tapering off unnecessary medications, switching to safer alternatives whenever possible, and gently rebalancing your brain chemistry naturally. This, honestly, is the most empowering and hopeful part of this entire discussion. Drug-induced dementia is very often reversible when caught early enough and when the medication burden is appropriately lifted and removed. Many seniors dramatically regain mental clarity, physical energy, and robust memory function within just weeks or months of stopping the problematic drugs. Your brain is remarkably resilient and inherently capable of healing, but only if you give it a real chance to recover by diligently removing what is actively harming it. polypharmacy, particularly with anticholinergic drugs, isn't just dangerous and harmful, it's completely preventable. And that profoundly makes it the #1 hidden medical threat to the minds of our entire aging population, a crisis demanding immediate and widespread awareness. Now, as we conclude, I want to hear directly from you, our engaged and discerning audience. Which of these 9 medications are you currently taking right now? Have you noticed any troubling brain fog, an increasing tendency towards forgetfulness, or any subtle shifts in personality since starting a new medication? Are you willing to take the crucial step of talking to your doctor this week about meticulously reviewing your complete medication list? Please share your invaluable experiences and honest opinions with us in the comments section below. We genuinely want to hear from you, as your story and your insights could potentially help another senior avoid this same dangerous situation, safeguarding their cognitive future. Thank you for watching, and remember, I'm Dr. Michael Kent, and I am here to help you stay sharp, healthy, and strong for all the years ahead, preserving the precious gift of your mind.